Hey guys, Dr. Josh Jagoda here, and today we're going to discuss a little bit of low back pain and what you can do at the office or at home to make you feel a little bit more comfortable and increase some movement as well as stability within the spine. So first thing first is we sit in these chairs way too long. So just adding a stability ball or a Swiss ball or exercise or a physio ball, whatever you want to call it, adding a ball to your seated position is just going to add some movement. So just by staying in this position, you're going to be rocking back and forth a little bit, moving more than you would traditionally on a stationary chair. So that alone is just going to add a little bit more movement. And when you're in this position, what that's going to do is help strengthen your core. So while you're doing your exercises or maybe even your desk work, what you can do is a couple of these movements, and this will help probably eliminate a little bit of your low back pain, add some mobility as well as some stability to the spine. So first things first is you want to be able to be comfortable on the ball. You want to be able to slide back and forth, side to side, front and back. And just like we perform a pelvic tilt, kind of like this, you want to be able to perform a good, comfortable pelvic tilt on the ball itself. And then you should also be able to circle your hips back and forth. Okay, so these are very, very simple movements. And then as you start increasing your stability, you may want to just like kind of kick out one leg, kick out the other leg, and that will force you to fire your core a little bit and take some of that stability back into the spine. And so that gets a little bit more advanced, but again, this is still more seated. So we're going to dive into a little bit more of a stability exercise and mobility exercise. The reason it's stability is because we are going to be firing the core, but at the same time we're going to be decompressing the spine. So one of the movements I like to do, and there's a whole host of movements that I will do with the stability ball, but we're just going to get into one today. And you may see this, you'll go into this, just this posture here. This ball is a little bit big for me, but at the same time what you'll notice is that I'm just going to get into this almost plank-like maneuver here. So we'll get into this plank move and we'll come right into here, and then at the same time at the end of that plank you can let go, you can hold your arms up here, you can hold them back here. A lot of people I've seen pull back here, but I personally don't like this because if you're new or getting introduced to this type of exercise and you start to fall, you don't have your hands, and so that can cause some more injuries. You can fall on your shoulder, dislocate a shoulder, maybe tear a shoulder, maybe fall on your face, hurt your neck, etc. So let's avoid other problems. Let's fix one problem and avoid other problems. So what you'll do is you'll take your arms down to your side. I'm going to just back up just a tad. You'll take your arms down to your side, almost like you're kind of like a speeding bullet or like a Superman. Really not overextend like this and not underextend. You want to pretend like there's a wooden plank on your back and that's in a 45 degree or maybe like a 35 degree angle, and it's just following. Like if you rest a board on the back of my head and my butt and my back, it should stay nice and straight. And so you'll just kind of hold this position for about 5 seconds and then relieve and kind of decompress. When you decompress, you may want to spread your legs a little bit and then really open up. And so what you're doing is in the middle of your pelvis, and the joint line should be right across the center of the ball here. And so that will decompress or add a flexion into the spine. So what you'll be doing is taking that stability and really locking it in the spine at this 35 degree angle, and then relieving that pressure after. So again, we'll do 2 sets. It'll look like this. Again, speeding bullet, 5 seconds, give or take. Maybe crawl forward a little bit, spread your legs a little bit. Relief of it. Spread your legs back a little bit. Narrow them. Come up. And again, if you're having trouble, you can put your hands on the ball, and that'll stabilize the ball. You can put your hands here, but again, you really want to make sure you're firing your core. Head straight, your head and neck should not be up and down. And then you'll relieve your legs, put your arms down, rock forward a little bit, and really find that spot. And that'll help decompress your spine. So this is a good procedure to, one, get started by just sitting on the ball, and two, if you want to get a little bit more progressive with regard to stability and mobility of the low back, this is a great way to both decompress or mobilize as well as stabilize the spine. Thanks for stopping by. I'm Dr. Josh Jagoda, and we'll see you next time.